There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
All you ever wanted to know about hypertension, written by Dr. Anna Varghese for Merlin Health. Follow us on Facebook at /HelloMerlin12080. Isn't that supposed to be the ideal blood pressure? Your doctor has probably been urging you to keep your blood pressure about that or lower. It is estimated that about 1 in 3 Americans have high blood pressure and only about half of those people have it under control, CDC. The probability that a middle-aged or elderly individual will develop hypertension in his or her lifetime is 90%, Harrison's Internal Medicine, so your odds of developing hypertension are pretty high. If you've struggled with high blood pressure, remember that it is important to educate yourself and be an active participant in your healthcare. Understanding high blood pressure in more detail might help you to take it more seriously and become an active participant. Blood pressure is defined as the amount of pressure in the circulatory system. Blood is carried from your heart to various organs through vessels or tubes called arteries. When your heart beats, it pumps blood throughout the body. As the blood is moving along, it pushes against the walls in your arteries. The strength, or pressure, that is exerted on the artery walls is your blood pressure. We all need to maintain a certain amount of blood pressure so that we can get enough energy and oxygen to our organs. However, if your blood pressure is too high, it causes strain on your arteries and can lead to some major complications. Your blood pressure is measured as two numbers, the systolic blood pressure and diastolic blood pressure reading. The top number, systolic blood pressure, is a measure of the blood pressure as the blood pumps out of the heart and into the arteries. The second number, diastolic pressure, occurs as the heart rests between beats. For example, if your blood pressure is 120/80, 120 is the pressure when your heart is beating and 80 is the pressure in between heartbeats. Hypertension is classified as either essential hypertension or secondary hypertension. Essential hypertension, which affect 9,095% of patients who have hypertension, is a condition in which the cause has not yet been fully understood. It is due to non-specific lifestyle and genetic causes. Secondary hypertension affects 510% of patients with hypertension, is defined as high blood pressure due to an identifiable cause like kidney disease or use of birth control pills. What causes hypertension? Although the mechanisms underlying high blood pressure, hypertension, are not fully understood, we know that there are several factors at play that affect your blood pressure. Some of those factors include blood volume, which is the total amount of blood in the body. There is a link between increased salt intake and increased blood volume. Your kidneys filter your blood and remove excess fluid through the urination process, but increasing the amount of salt intake also increases the amount of sodium in your bloodstream, which reduces the ability of your kidneys to remove water. This results in extra fluid and higher blood pressure. Systemic vascular resistance is the resistance that must be overcome to push blood through the circulatory system. When your arteries constrict, or become narrow, it causes an increase in resistance to blood flow, which in turn requires a higher amount of force to create blood flow. Why should having high blood pressure matter to me? Having high blood pressure can affect various organ systems and cause very serious complications as discussed below. Heart disease. Hypertension is a risk factor for coronary artery disease, which affects blood vessels that supply blood to your heart. When arteries are narrowed, they don't allow enough blood to flow freely to your heart, which can lead to a heart attack. Left ventricular hypertrophy. Hypertension can also lead to an enlarged left heart. Basically, your heart is forced to work harder due to high blood pressure. This causes the left part of the heart to thicken, which in turn limits the ability of the left ventricle to pump blood to your body. This condition increases the risk of heart attack, heart failure, and sudden cardiac death. Stroke. A stroke occurs when brain cells in a part of your brain begins to die due to it being deprived of oxygen and nutrients. High blood pressure can damage arteries throughout your body, including the brain, which means they can clog or burst more easily. Weakened arteries in the brain put at higher risk for having a stroke. Kidney failure. High blood pressure is one of the most common causes of kidney failure, Mayo Clinic. As mentioned previously, high blood pressure affects the arteries in your body, including the kidneys. Damage to the arteries can cause injury to your kidneys. When your kidneys are injured, they may not be able to filter fluid and waste effectively from your blood. What are the symptoms? Most of the time, there are no symptoms of high blood pressure. This is why hypertension is referred to as a silent killer. This is also why it is important to have your blood pressure checked regularly. Some of the symptoms that most people commonly associate with high blood pressure, like headache, blurred vision, nosebleeds, chest pain, only occur when the blood pressure is extremely high. What are some of the risk factors for developing hypertension? Obesity. The CDC defines obesity as having a BMI of 30 or higher. Here is an easy-to-use BMI calculator from the Mayo Clinic to check your number. Unhealthy diet, too much salt, not enough potassium, too much alcohol, smoking. Age, your blood pressure tends to increase as you get older. Genetics and family history. Stress. Gender, before age 55, men are more likely to develop hypertension. After age 55, women are more likely. How is hypertension treated? Lifestyle interventions. Changes in lifestyle have an impact on both the prevention and treatment of hypertension. In clinical trials, weight loss and reducing salt intake have been shown to prevent the development of hypertension. In patients who already have a diagnosis of hypertension, weight loss and salt reduction can help to reduce the number of medications or dosage required to control blood pressure, even if you are unable to completely come off the medications. Dietary changes that can lower blood pressure are weight loss, reduced salt intake, increased potassium intake, moderation of alcohol consumption. Besides dietary changes, quitting smoking and reducing stress have also been shown to reduce blood pressure. Weight loss goals should be to attain and maintain a BMI of less than 25. Regular physical activity helps to reduce weight, which in turn leads to decreased blood pressure and lowers the overall risk of cardiovascular disease. Blood pressure can be reduced by doing 30 minutes of moderately intense physical activity, such as brisk walking, 67 days per week. Salt intake should be reduced to less than 6 grams. Dietary approaches to stop hypertension. Diet has been shown to effectively reduce blood pressure over an 8-week period. The diet consists of a diet high in fruits, vegetables and low-fat dairy products. Fruits and vegetables are great sources of potassium, magnesium and fiber. Dairy products provide an important source of calcium. Moderation of alcohol consumption also helps to reduce the risk of developing hypertension. Men should consume 2 or less drinks per day and women should drink 1 or less drinks per day. Medical treatment. There are several medications that doctors can prescribe to lower blood pressure. Here is a brief overview of some of those medications. Diuretics, often called water pills, are medications that lower your blood pressure by causing your kidneys to eliminate sodium and water, which reduces blood volume. Beta blockers. These medications work to open your blood vessels and reduce the load on your heart. ACE inhibitors. These medications work on the renin-angiotensin-aldosterone system. In brief, when blood flow to the kidneys is reduced, it causes certain enzymes and proteins to be secreted, which then cause constriction, or narrowing of blood vessels. ACE inhibitors block this cascade, thereby preventing the constriction of blood vessels. Angiotensin II receptor blockers, ARBs, help to reduce blood pressure by blocking angiotensin II from binding to its receptors. Angiotensin II increases blood pressure by causing blood vessels to constrict. So, ARBs help to block the action of angiotensin II by preventing its binding to receptors on blood vessels. If you feel that you might need some help getting your blood pressure under control, or you just want to learn more, the doctors at Merlin are only a click away. Download Merlin today. References: Longo DK, Fauciaz, Casper DL, Husser SL, Jameson J, Los Causo J. eds. Harrison's Principles of Internal Medicine, 18E. New York, New York, MC. Graw-Hill, 2012. What is high blood pressure? Heart.org, American Heart Association, October 2016. High blood pressure, hypertension. Mayo Clinic, February 2, 2018. High blood pressure. Centers for Disease Control and Prevention, CDC, February 16, 2018. Hypertension, high blood pressure. Cleveland Clinic, May 10, 2017. What is blood pressure? Blood pressure UK. Beavers, Garrett, et al. The Pathophysiology of Hypertension. National Center for Biotechnology Information, National Institutes of Health, April 14, 2001.